There are several definitions in this subgroup that constituted burnout. It's an alarming avenue. It is important to take systemic approach to address burnout that focuses on the structure, organization, and culture of healthcare. And this clinical storm is detrimental to the quality of care being provided, harmful to individuals in the workforce, and costly. But my question is, do we have exact numbers? How many individuals and how costly it is? Factors affecting physician wellness are three things: qualification, diplomas, requirements, administrative amount of money that goes around, and the time. I give an example of a game, Burnout Dominator. You might be familiar with that or ask your kids about it. It's a game to race to the top of the hill in a manic mode, cannot be stopped. There is a challenge for this. Does it fit into medical practice? There is an analogy. There are risk denominators, which include, of course, stress, administrative rules, quality of care contributors, lack of time with families, limited resources, and racist environments. This creeped up in the last 5 or 8 years. And these are known facts. There are examples. The patient called me, colored girl. Senior doctor trained me, said nothing. The doctor who was training or in charge said nothing. Patient tells the clerk, "Can I have another doctor? White doctor, please." Another one, "I do not want to have a Muslim surgeon." Admin did nothing. We need clinical training, diversity training, address prejudice, and need organizational response and develop concrete methods to tackle this problem. Racism is real and it does exist. Martin Luther King Jr. said, people fail to get along because they fear each other. They fear each other because they don't know each other. They don't know each other because they have not communicated with each other. How true. Along with this wellness, talk will not be complete unless I mention a little bit about physician physical health check. Like your patients, get expected evaluation at intervals suggested by specialty societies, periodic physical examination, proper counseling, follow recommendations, follow-up activity and exercise with diet and nutrition. Get cancer screening for prostate, GI, lungs, ovaries, uterus, and breast. Get it before it happens. Get physician burnout before it happens. Hearing loss leads to dementia, loneliness, depression, and possible injury. Not comprehending very well. Not hearing a car approaching or a bicycle approaching. Unable to hear the instructions in emergency. So we come to therapy and coping with prevention, management of burnout, replan and streamline workflows, improve professional satisfaction, sleep more, do more exercise, and eat healthy. Cut down on caffeine and alcohol. Learn to say no when it requires. Take a break and stay positive. Limit hours of work. Hire support to staff EHR system. That charting and paperwork is the same category as physician has no time. Our aim is to see patients and not spending, after seeing patient 3 times the more, clocking the charts. We got to turn negative leadership behavior into positive. manage EHR with a positive attitude and change what is not there. Change the practice behavior. Do some yoga and meditation. It reduces stress, eliminates non-essential tasks, access to resources and friends, improves the work culture. Any age, you can get some time to do that. Administrative staff could make mandatory time for yoga and meditation to encourage physician wellness. It will do a lot to the patient outcomes. It will help not to be short-tempered with patients. It will make you more engaged rather than less engaged with patient. Overwork makes you less friendly with the patient. You don't have time. Relaxation will help. 14% is the figure they say contributes to errors. Reduce the error. Revise, and learn to calm down. Patient-doctor relationship is on the downslope for the past 10 to 12 years. It will take time to improve that. I hope you'll enjoy the talk. Again, it was my pleasure. Thank you.